Okay, so the rest of autonomic dysreflexia. So what happens then for symptoms and signs? It's characterized by a sudden and very severe increase in blood pressure, so very bad hypertension. They'll have profuse sweating above the level of the injury because they're having vasodilation above the injury. Below the injury, they get vasoconstriction, very cool, very dry skin below. They're going to be complaining of a pounding headache, and this is from the high blood pressure. Right, they're going to have goosebumps above the level of the injury, so it's piloerection for the medical term. And the blood pressure is going to also make their vision blurry. It can really be caused by anything, right, that's putting some type of annoying, noxious stimuli into the spinal cord signals. So some common things that it causes: overly distended bladder. All right, maybe their catheters are blocked if they have an indwelling catheter, or they haven't emptied their bladder when they should have. They're constipated, so the bowel is filled up with fecal matter, and they have what's called a fecal impaction. They could have kidney stones, urinary calculi. Maybe they had surgical incisions or pain from other wounds, such as pressure ulcers. If it's a woman and she's in labor, all right, she won't be able to feel her contractions, so the uterus can be triggering it. If it's a man, if he has too much pressure on the head or the glands of his penis, it can trigger it. And then even things like ingrown toenails can cause it. To treat it, we need to find as soon as possible whatever the stimulus is and get rid of it. Alright, so take their clothes off, look for wounds, empty their bladder, see when their bowel movements were, so that we can try and get rid of the stimuli so we can quit stimulating the sympathetic nervous system. We need to control their blood pressure. Alright, so they will get antihypertensive medication to try and bring it down quickly. We're going to increase their head of bed, HOB means head of bed, to try and use their orthostatic hypotension to our advantage. We know they're at risk for it, so we're trying to make their blood pressure drop. So we'll go ahead and sit them straight up in bed at a 90-degree angle to try and do that. Next up is phantom limb pain. Now we're seeing some more of this as we've been out to war, because a lot of our veterans are now coming back with complications where they've had to have limbs amputated. So for some reason, we don't really know what causes it. In phantom limb pain, they still get pain sensations in that limb that's no longer there. It most typically happens in limbs, extremities that we have two of. So like a foot, a leg, a hand, an arm. Alright, it can happen in the immediate injury period, right after amputation, and it can happen months later. The thought is that something's going on in the brain that is signaling the pain response, because there's no other nerve endings going anywhere, so it can't be neurological. Right? They do see an increased incidence in people who've had post-traumatic stress disorder or patients who've had traumatic loss of their injuries. It tends to be triggered or influenced by their emotional state, right, and sympathetic nervous stimulation. Things that they found that work best are things that trick the brain into seeing two healthy limbs again. And a lot of the research is actually being done with the vets through the VA to try and find treatments for them. Right, but they use things like augmented reality, where they create an avatar of the individual, but in augmented reality they have two of their limbs instead of just one. Or they use mirror therapy like these men are doing, where they put a mirror beside the healthy extremity and then they look into it and they'll see two of their limbs again. Right, and it shuts off that pain response in the brain that seems to be going awry. The next portion is about disorders of brain function. Alright, so when we talk about the brain, right, you've probably heard people say you might be right-brained or left-brained. The different hemispheres tend to correlate to different types of traits. So, like your right hemisphere tends to be more your creative, your spatial awareness kind of things. The left hemisphere has to do more with writing and analytical type skills. You have different lobes in your brain. Each lobe has a different function. For instance, your frontal lobe usually goes with decision making and speech. Your temporal lobes are the ones that are behind your temples or your ears. That goes with hearing and smelling. The occipital is in the back. that goes mostly with vision, and the parietal is in the top towards the back half of the brain, and that's your speech, taste buds, reading, things like that. Your brain is very sensitive to changes. It doesn't like changes in pressure, glucose supply, oxygenation, or blood flow very much at all. One of the things that helps us to understand intracranial pressure is the Monroe-Kelly hypothesis. What it says is in adults, because your brain is in your skull, alright, the skull cannot adjust if there's changes in pressure, meaning it can't flex, it can't open up, right, because your skull is fused. Alright, and the bones are hard, they don't have a lot of give. So there's three main components of things inside your skull or this fixed box, and that's your brain matter, your blood, and your CSF, or cerebral spinal fluid. The ratios of them are about 80, 10, and 10. The Monroe-Kelly hypothesis says that if one of those volumes is off, alright, like if the spinal fluid goes up above 10%, the other two have to compensate. They go down. So you have to give in the blood or the brain tissue then. It only applies to adults because when babies are born and infants, they have their fontanelles or those soft spots that are open, and the bones haven't fused together yet. The problem is if you have an adjustment to one of those areas of the brain that the ratios are off, it's going to increase the ICP. Now your ICP, or intracranial pressure, should be between 0 to 15 millimeters of mercury. If it's any higher, then it causes the brain to herniate, and this would be very bad. So at the base of your skull, everybody has a foramen magnum. That's the hole that your spinal cord comes out of from your brain. Alright, if there's too much pressure in the brain, inside the skull, intracranial pressure, then it's going to force the brain down and herniate it or push it through that little hole. In this example, this person has too much blood. Alright, so they've increased their blood ratio above that 10%, and look how this tissues have gone down or been squished to compensate for it. The brain is going to respond negatively if it doesn't get enough oxygen or blood flow. Hypoxia is whenever we're deprived of oxygen. Alright, so even though there's blood flow, for some reason they're not getting enough oxygen to the brain. This can be because of things like carbon monoxide poisoning, their lungs aren't working to get enough oxygen, or they have really severe anemia. Anoxia means to stop breathing. And if we stop breathing, it's going to quickly turn the brain off to controlling the heart, and they're going to go into cardiovascular arrest. Ischemia is where we've had a reduction or an interruption of blood flow to the brain. Alright, so if we don't have enough blood flow, then that means the brain doesn't get the oxygen it needs, it doesn't get the glucose it needs, it can't get any of its nutrients, it can't get rid of its waste. Things that cause ischemia are things like stroke, head injury, heart attacks, and low blood flow. Cerebral edema is a complication where the brain is swelling. Alright, so what happens in cerebral edema is that you have energy stores in your brain. Alright, if you don't have enough circulation or oxygen to it, alright, it will use up those stores very quickly in about 2 to 4 minutes. And this is why we say people haven't had oxygen, alright, they're at risk of brain damage after a couple of minutes. ATP gets depleted very shortly after that. Right, and then you are out of oxygen for metabolism, so they're not going to be able to be in aerobic metabolism. The primary function of your cerebral energy is to maintain your ionic gradient. So those are those pumps that control what goes in and out of a cell. Right, the problem is that if they fail, because we don't have enough supply anymore of our things like ATP, glucose, oxygen, right? It's our sodium potassium pump that's our immediate biggest concern. It's going to break down. You're going to have a huge influx of sodium in the brain tissue. That means that water is going to come follow the sodium, and it's going to cause cerebral swelling or edema. So it's an increase in the tissue volume because there's an abnormal fluid accumulation. Right, it can be a vasogenic consequence, which means blood vessels are involved. Something has disrupted the blood-brain barrier, and it's allowing too much water and proteins to leave the capillaries and move into the tissues. It can also be cytotoxic, where we have swelling of the brain cells, and then because of the inflammation, fluid is going into them. We measure pressure with a device called an intraventricular catheter. Alright, so what happens is they have to drill a little hole in the skull. They feed a catheter through into the ventricles or spaces in the brain. It's going to drain off cerebral spinal fluid, or CSF, into a drainage system. Alright, whatever number that spinal fluid goes up to on the drainage system tells us what their intracranial pressure is. Alright, so if they drain out and they're at 64, then their intracranial pressure is 64. If it drains out and it's down to the level of 6, then their intracranial pressure is 6. What happens with ICP is that if we don't treat a high intracranial pressure, the patients are at risk of dying. Alright, and here's why. So something happens that they have an insult to their brain, or their cranial insult. The tissues then react by swelling. Alright, the swelling of the tissues then increases the proportion of your tissue, alright, which means pressure is going to go up inside the brain. Because you remember it's a fixed skull, alright, so if we increase it, we're going to have damage to your blood supply. It's going to compress it, alright, because that ratio has to go down now. So we're now not in the 80-10-10 ratio anymore. We're going down on the amount of blood supply we can have. That decreases your cerebral blood flow, which means your blood doesn't care, your brain is not getting as much oxygen because it's not getting as much blood. So then your brain cells start to die. They cause more edema, and the necrosis tissue, or the cell death, is going to happen. Alright, the increased edema in the necrotic tissue are going to increase your ICP some more. Alright, and that's going to have compression of your brain stem, which holds your respiratory center. So your breathing's not working, so your CO2 is going to go up. That causes vasodilation. Alright, so now we've increased the blood volume on top of the increased interstitial tissue in the skull, so your ICP goes up even more. And this will eventually lead to death, because herniation is going to happen, where it's going to try and shove the brain down through that tiny hole and cause damage. A traumatic brain injury is whenever something has happened directly to the brain to cause damage to it. Much like your spinal cord, we have two phases. You have your primary injury, and this is the initial damage. It can be things like a contusion, a laceration, a concussion, something like that. The secondary injuries happen because of fallout or consequences from those primary ones. So we have bleeding, ischemia, infection that are going to happen. The brain can be damaged a couple of different ways. So you can have coup and contra-coup injury. Coup happens whenever the head gets directly damaged by something. So the head gets struck by an object. In this image, it's a baseball bat. Coup is where the brain gets damaged, where the item has struck the skull. Contra-coup happens whenever the skull rebounds backwards or recoils and strikes the opposite side of the skull, and it happens from the brain hitting the inside of the skull. Shaken baby syndrome, for instance, is an example of contra-coup, because you don't have an actual mechanism of injury, it's just from the baby being shook. Alright, so the skull is going to slide forward and hit the front and have contra-coup on the front. It's going to be damaged from getting hit in the back. Right, and this is how you get damage to the brain from shaken baby. Some basic vocab for you. So concussion is anything that causes a momentary interruption of brain function. It doesn't have to involve blacking out or loss of consciousness. It can just be dazing, unawareness, seeing stars, things like that. A contusion is where we actually bruise or get a hematoma on the surface of the brain. Alright, and it's most often where the brain comes in contact with the skull. And we can have a diffuse axonal injury, so that's scattered, where we have microscopic injury to various axons or different parts of the brain. And I'll stop here for this part, and we'll pick up next with complications from head injuries.